Do you think you know nursing? A lot's changed, and you might be surprised by the variety of careers today's nurses are choosing. Not far from the School of Nursing in downtown Kansas City, Obie Austin is back in the neighborhood where he grew up. As a nurse practitioner at the Greater Kansas City Free Health Clinic, he manages patient care for large numbers of people who are uninsured or who may not otherwise receive health care.
When's the last time you had any blood pressure medication? How many days ago? Our primary goal is to take care of the underserved population, those that are underinsured or uninsured. We see patients from a general medicine standpoint as well as an HIV standpoint. I work on the general medicine side. I run 2 clinics per day. One is usually a chronic care patient where I see patients that need follow-up care, mostly people with hypertension and diabetes and high cholesterol, things like that. Then I will usually in the afternoons, a couple of days a week, do an urgent care clinic for those folks that have acute care problems like upper respiratory infections or urinary tract infections that need to be seen that day.
Obie earned his master's degree at the UMKC School of Nursing. He teaches at UMKC in addition to his work at the clinic. Returning to the urban core, an area in dire need of healthcare providers, was a conscious choice.
Once I decided that I wanted to do something like nursing, then I always knew that I wanted to be a part of giving back to the community that I grew up in. There's a lot of great providers out there that can help out in areas where there's not a demand. So I figured, if I was a talent at all, it would be wasted somewhere else, that I need to come to the inner city where folks don't get the opportunity to get good quality health care.
While Obie Austin spends his days assisting patients who might not receive care, Vicki Keck spends hers helping families cope when their children are severely injured. At Children's Mercy Hospital, steps away from the UMKC School of Nursing, Vicki is part of a rehabilitation team that works with patients who have suffered severe brain or other injuries. Often, they are children who have been in car accidents. In addition to helping them recover to the greatest extent possible, Vicki assists families in learning how to care for the child when it's time to go home. And the most rewarding part of her job?
Probably seeing them go home and being able to smile at us, and when they come back to visit and you get hugs from them, and it's just amazing to see the progression, and that right there is a reward.
Vicki returned to the UMKC School of Nursing to enter the RN to BSN program, which allows registered nurses to complete their bachelor's degrees. With that behind her, she is now in the master's program.
I want to be able to develop my own treatment plans and have prescriptive privileges to be more autonomous in working with my patients and families. And for all of that, I do need my nurse practitioner.
That kind of commitment to nursing education is something Mighty Enriquez likes to hear, and a drive she tries to build in her students. An alum of the UMKC School of Nursing, Mighty is a faculty member and also maintains a clinical practice serving patients with HIV and AIDS. Mighty has been a pioneer of support systems for students and for a new course she's begun, Spanish for healthcare providers.
My family is from Cuba. I didn't speak English until I was in kindergarten. I went to public school, and that's how I learned English. So I learned Spanish first. So I guess it has really led me to a career of serving populations that are underserved.
Mighty is also an active community volunteer, using her nursing degree to promote wellness, awareness of HIV, and the tremendous opportunities open to nurses.
And my primary efforts are educating others about HIV disease, either the community to prevent transmission or healthcare providers to help them identify people at risk so they can either prevent transmission or get them into care.
LifeNet responds to the request of EMS agencies and outlying smaller hospitals to transport quickly the critical patients to tertiary care centers.
Eric Roberts and the LifeNet team have to be ready to go in a moment's notice and may make up to 3 or 4 flights in a 24-hour period.
Our priority is quick assessment of the patient, immediate treatment, and transport. We don't spend a lot of time on the scenes. Our key is getting in, getting report quickly, evaluating the patient quickly, doing whatever we need to intervene right away, and then getting to the hospital as fast as we can. Coming to LifeNet was my dream.
Eric began his career as a paramedic. After working several years to qualify for the flight nursing position, his work has come full circle in many ways as he is once again assisting patients in a crisis situation. Like Vicki, Eric completed the bachelor's program at UMKC and has entered the master's program.
What I learned in that year completing my BSN was incredible, and I think that all nurses should be able to attain that level of knowledge that I had in that year. What I like best about working with LifeNet is that it's exciting. We normally don't get called out on something if it's not intense and there's not a lot of anxiety and emotions that are built into it. And I like that aspect of being able to get in and to make a difference in the short time that I'm with the patient, and to know that by my helping them, I actually make a difference to them.